When the church purchased this building, they had a special board that was in charge of the building, and they asked me to put on a one-day seminar. We found out the need was for chronic care. So we decided to do chronic care for Battleground Healthcare. One of the things that I remember in the early days, Battleground every year in July has a parade, and we used to partake in the parade, and we would drive an old car or something with the Battleground name on it. We would have a booth, we would do blood pressures for people, those kinds of things. So Battleground community has been wonderful to Battleground Healthcare. The first requested service was for dental. And then once that was in, then we started getting requests for rehab services. So we looked at chiropractic, we looked at massage, and were able to add those as well.
One day I was reading the Oregonian and I saw that Northwest Medical Teams had a dental van, and I called them up and I said, if I can find dentists and I can find patients, will you bring it over? And they said, sure. Then I read that Clark County had a dental van that had been donated to the Free Clinic of Southwest Washington, and I called them and made the same pitch, and they said sure. And I think it was the dentists who started saying, why are we meeting in a van when we've got this building upstairs? Now there's a clinic.
I felt it the day I walked in the doors that this was an organization that cared, had compassion, just was here to serve the community and make lives better.
Peter Becerra came on board. What more could we ask for? Every time Peter attended a meeting or told someone about Battleground Healthcare, they would donate money, and the monies began to come.
We went out and we started introducing the clinic to the community, attending different chamber meetings, different luncheons, and so the interest started growing from that point on. First time I got a large sum of money from somebody, I couldn't talk to them. I had to put the phone down because the emotions were very strong. It was very emotional because knowing who they were and what they were giving, and I think about the people that were benefited from that and what their lives are turned around.
We have been privileged to have the support of our health systems to do what we do. So our challenges has been to meet the needs of the community and to continue to grow and have the funding resources to be able to do that.
The greatest first success of Battleground Healthcare was when our patients began to give back.
There was a gal that came to us here in the clinic, got to the point in her life where she couldn't do much because of pains that she was experiencing.
I knew this program was really going to change me when I met the team of people who were there to help me. Every time you come, you get a hug, and every time you come, they're glad to see you. Immersed myself in absolutely everything they offered me. Went to every appointment. Sometimes I had 3, 4, 5 appointments a week.
After she went through the program, she came back to us and said, I want to do something for this clinic. What can I do to give back? Maybe I can do your janitorial work. And so if you were to walk in here every Friday, you would see her doing janitorial work for us.
So when things like that started happening, we knew that Battleground was making a difference.
The volunteers and the staff who are here, they are so excited when they are working with the clients, when they take the phone calls and when they see the people in the clinic and know that they're making a difference in their lives.
It's this concept thing that somebody out there really cares, and they're willing to give up their time that they could be doing other things to take care of me.
When you come to volunteer to serve other people, to be a part of the team, you think you've come to bless others. And in fact, you get the blessing.
A nonprofit makes it to the 10th year, you're pretty much on your way. And I'm just so happy to hear that and see that it is functioning that way.
The needs of this community are growing as the community becomes more diverse, as population increases in North County. So the need for Battleground Healthcare isn't going to go away. There is more to come for this ministry, and we have to be about getting it there.
Being in the community is what Battleground is here for. Yes, we do medical care. Yes, we do rehab services. Yes, we do dental. But the real message, the real feeling is the love that's shared.
My hope is that Battleground Healthcare can have the support that it needs from the community, from our funders, and being able to have the facility and the professionals to be able to deliver this quality, comprehensive, integrated care as is needed in the community going forward.